issues for people with intellectual disability. If you can address these, you can significantly improve their well-being and possibly save lives. Whatever your role, if you can get this right, then you can make a huge difference. People with intellectual disability die up to 20 years younger than the rest of us, especially if they have very high support needs. They experience on average 5.4 conditions, half of which are undiagnosed or poorly treated. And in addition, often they do not receive health promotion information or disease prevention interventions. All people are at increased risk of poor health if they are devalued in society, poor, less educated, isolated, have problems with communication, or make poor lifestyle choices. All of these are factors commonly experienced by people with intellectual disability. Pain from causes such as dental, musculoskeletal or gut problems can be missed, especially if they can only be communicated through changes in behaviour. The prevalence of mental health disorders is very high in people with intellectual disability. Depression, psychotic and anxiety disorders are often unrecognised and untreated. Psychological problems are common and arise from learnt responses to environments not of their choosing. Psychological, physical and sexual abuse frequently occur and may be hidden or not addressed and can lead to post-traumatic stress disorder. Gut problems are commonly seen. Severe constipation can kill if left untreated. Death from severe chronic constipation and the development of sigmoid volvulus or twisting of the large bowel do occur and can be avoided. The bacteria H. pylori is common in this population, especially if they live in institutional care. H. pylori causes ulcers, which can be very painful and potentially lethal. Gastroesophageal reflux disease is very painful and has long-term adverse effects such as cancer of the esophagus, aspiration pneumonia and dental disease. Hypogonadism and undescended testes associated with conditions which also affect the neuromuscular system are commonly missed. People with intellectual disability are commonly over-medicated or wrongly medicated. They're often taking neuroleptics and anticonvulsants for the wrong reasons. Based on community samples, up to 40% of people with intellectual disability are taking neuroleptics, usually for behavioural management. There is inadequate evidence to support the use of neuroleptics in behavioural management. Epilepsy is overdiagnosed or at times not diagnosed, and it is often inadequately reviewed by medical practitioners. Accidents, falls and burns are common, especially for people who have comorbidities such as epilepsy, or alternatively are taking medications with sedative side effects. People with intellectual disability get infections, but due to communication and recall difficulties, these infections may not be diagnosed and treated. They experience low rates of immunisation and standard health screens such as those for breast and skin checks and pap smears. There are many barriers to a good lifestyle in people with intellectual disability. These result in a lack of exercise and poor nutrition, which leads to obesity and the associated increased risk of diabetes and conditions such as vitamin D deficiency and osteoporosis. Vision and/or hearing impairments are much more frequently found than in the general population. Dental and oral health is often very poor due to inadequate dental hygiene and other factors. So how do all these health conditions and issues impact on a person with intellectual disability? Well, they can experience early death. They have persistent poor health, which leads to a poor quality of life. If a person has many health conditions which are left undiagnosed or untreated, they can become chronic and cause serious damage or death. It's not a great picture. What can we do? Annual health assessments have been demonstrated to pick up unmet health needs. Whether a person with an intellectual disability has problems with communicating, being aware, actively monitoring and documenting their well-being can lead to an early detection of pain and distress. You should discuss these changes with your health provider. Helping a person to live a healthy life through eating well and exercising is vital.